person or a patient. You have a Vata, Pitta and Kapha. We have discussed these things at length, but here we must determine the imbalance, which is the imbalance, how much is the imbalance, what is the disease, and how it is expressed. All these things are taken into consideration. Then you take the special or specified oil specifically only for you, who has the right diseases. So the oil will go after you massage inside the body. It will enter to the pores of the skin, go to the organs, eventually to the cells and cellular components. All this takes time. So you may have the treatment for 7 days all the way up to 2 months. These treatments will then entail into our goal. What is our goal? Our goal is to remove the toxin, so detoxify the system. But if we don't stop after removing the toxin or toxins, we go and rejuvenate the system. We build the cells and tissues the way how they would be in a normal person. Okay, now suppose if I go in and remove the toxins. See, most toxins are lipoidal. That means they are not water soluble. And based on that kind of concepts, this oleation or oil therapy is involved. Then when the oil slowly goes inside inside the body, then it enters to the cells and cell walls. It has to go through the cell walls. Cell walls are made up of protein and lipids. So the vehicle which we are using, oil, is very well and very carefully thought out. Okay, now the oil goes inside the cells and retrieves or conjugates with the toxins which are lipids. Then we have to take them out. So Panchakarma has 3 phases. One is a pre-treatment. In Sanskrit we call Purva Karma. Then the main treatment, which is the Pradhan Karma. And then after all this thing is done, then you have to have the post-treatment, which is Paschatya Karma. All these things is done very carefully by specialized physicians who are Panchakarma experts. Today with us we have a gentleman, Dr. Madhukant Pandya. He was a professor of Ayurveda at Ayurveda University, but his specialization is in Panchakarma. So any questions which you have and I cannot answer, I'm sure he will be able to entertain them much better. Then we have another center in North New Jersey, which is sort of a handle and operated by another Panchakarma specialist, Bharat Shukla. Now Bharat Shukla also took training in India at different Ayurvedic centers which were specialized in Panchakarma. And then we have another center in India where Dr. Prerak Shah is the main person, and you will see him in our documentary. So let me summarize and tell you very simply that this Panchakarma oleation therapy is not only in massage, but it cleans and rejuvenates. What kind of diseases we can handle? We have treated Alzheimer, we have treated muscular dystrophy, and even the difficult disease like ALS, which is amyotrophic lateral sclerosis, or Lou Gehrig's disease. We have treated MS. There are other type of diseases which will affect your body. Recently we had a gentleman with very good response to Panchakarma. He had Parkinsonism. In first treatment only, some of the tremors were subsided, his eyes started glowing, and he was extremely happy. Then we have another young lady with ulcerative colitis. That we have done with Panchakarma. Panchakarma can and does handle cancer kind of ailments too. So there is no limit to the utility or Panchakarma. The efficacy will depend on how well we diagnose, how and what kind of oils we have, what kind of medicinal plants we have used. In oil, as I said, we can have only 1 or 2 plants, and we can extract, or we may have as many as 50 or 75 plants. So it's a very complex discipline of medicine, and particularly Ayurveda. So please relax. Again, let me thank you for coming, and I will start the video at the end of my introduction. Thank you again. Bye.